So first things first for wound care change, I would check my orders to be sure that this patient is due for one, which they are, and I will gather my supplies and head into the room. So my patient's room is right here, and I will go in and perform hand hygiene as I'm walking in. Hi, my name is Jordan and I'm going to be your nurse today. Could you verify your name and date of birth for me, please? John Smith, 2247. Great. All right, that matches. And are you in any pain right now? No? Okay. So if he was in any pain right now, I would be sure to administer the prescribed analgesics 30 minutes prior to the dressing change to minimize the discomfort. But he's not in any pain, so we don't need to do that. And I would also ask if he has any allergies, which he does not have any allergies. All right. So I'm going to perform hand hygiene again. And I'll put on a pair of gloves. So first things first, I'm going to remove the old dressing. And I would note if there was any drainage on the dressing itself. And if there was, I would note the color, amount, and odor, but there's not, so I don't need to do that. And that's a good sign for the wound. And then I would also look at the wound itself. I would note any eschar or any slough or necrotic tissue, which I do not see any, so that's good. And now I will perform hand hygiene. And here's my irrigation kit I have. So first I will check the solution to be sure that it is not expired, which it's not, and it has been opened, so I will need to just lip it a little bit. Great, and pour in the solution. And I will also place the container in a way that catches my irrigation flow when I'm flowing out of the wound, when it's flowing out of the wound, so that's great, it'll be right there. And now gloves. Alright, and when I irrigate the wound, I'm going to do it about an inch away or above the wound, and it's going to be in a zigzag-like pattern, and I'm going to do it until the solution runs clear. Alright, so that's actually all that we need to do. The solution is running clear now, so I can take my irrigation set off to the side, and then I would take gauze and just gently pat around the surrounding skin of the wound. And now I will take my gloves off, and it is time to prepare my sterile field. So I would first check and be sure that it is not expired and that it hasn't been opened, which we're going to pretend it hasn't been opened. And I'm going to do this a little bit over here so that my sterile gloving can be close as well. So you can still see. All right. One-inch borders, and I'm going to fan away from myself. Great. Okay, and then I take my contents and I'm going to just dump them onto the sterile field. right? And normally I would use this if I was going to be packing the wound. I would moisten up the gauze in here, but I won't need to be doing that in this. Now I'm going to put on my sterile gloves. I'm also just going to move up my sterile field using the 1-inch borders just a little bit so it's not as go. And here we go. I want to make sure that this is clean. There we go. These are set up wrong. I'm just going to flip them. Not breaking sterility. I'm just touching the cuffs of them, but they were on the wrong sides. Now, my dominant hand. And then my non-dominant hand. Okay. And now I'm sterile. So I can take this and just toss it in the trash. On the ground, I guess. Alright. So now I have my sterile field. I know you're really far away, but I have my sterile field. And I have my pads and my gauze. So I'm going to take my gauze and fold it in half, just like that, and put it on the wound. And then another piece of gauze. I'm not going to touch my computer because I'm sterile. And then it looks good, so I will put the ABD pad dressing over it and tape it down, which now I am no longer sterile, but because it is taped down, I do not need to be. That's the last of the tape. So now the dressing is all taped down and the process is done, so I can remove my gloves. And I can clean up my sterile field. And I would lower the bed to a comfortable position for them, as well. I would keep it all the way to the ground, keep it locked, and I would perform hand hygiene as I'm leaving the room. I would make sure to, before I left the room, I would make sure to date and initial my dressing. So it would be something like JN and then the date and time. And then I would document the procedure and making sure to document how the patient handled it and when it is due to be changed next. And that is it. Thank you.